I hear our president talking about his health care plan. Which plan is it? Is it H.R. 3200 or is it one of the Senate bills? Which plan is his?
Thank you for the question. I think Kasai, you're up.
You know, it doesn't really matter. I mean, it's what's common between the Senate and the House plans is the public option, which our interpretation, our reading of the public option is a government-run healthcare. So it doesn't really matter what plan it is. There's a lot of details and a lot of provisions. Our approach has been the following. Whenever an issue is raised, whether it's the end-of-life counseling or whether it's the abortion issue or other provisions that the public is concerned about, our tool is to introduce an amendment to make sure that that's blocked. So when that amendment fails, it's a clue to us that the intention in the bill is really to pass whatever provision is being discussed. So it doesn't really matter whether it's the House or the Senate. There's a great deal of details in both bills, but what's in common between them is the public option.
Thank you. Thank you, Kasai. Thank you, Kasai. Megan?
Well, firstly, when the president undertook this whole effort to address our healthcare system and the expenses that we're spending on it, both personally and then as a federal government, it was more of a laying out goals that we would like to see achieved in this effort. And that's something that Senator Johnson is committed to, is those goals of access for affordable coverage, cutting the costs and reining in those costs so that we're on a more sustainable trajectory, and then ensuring that people have access, not just to coverage. This isn't just about covering people and making sure that I have an insurance card, because a lot of people right now have insurance cards. They have coverage, but they're finding out when they get sick and need to take that coverage, it's not there for them. They're being denied services. They're being overcharged for some of these services. They're not getting coverage for things because they have a pre-existing condition. So these are efforts that are the goals of Obama's plan. Right now, there is no Senate bill, and so I can't say definitively that the Senate bill contains a public option. But I think that we all have the same goals, and those are what I just outlined.
Thank you, Megan.